Welcome to selfdiscoverywisdom.com, formerly known as Self-Discovery Media. On these podcasts, you're going to hear people who speak from the heart. They've taken the journey in life. Many things have happened to them, but they've changed it to happening for them. And in their strength, their courage, they've discovered their abilities and their wisdom, and they are now sharing it here with you. Do enjoy each show. We bring it to you with love and knowing that it's going to help you on your journey of life. Good morning, good afternoon, and good evening, everybody. Welcome back to another edition of Your Health is Your Choice, right here on selfdiscoverywisdom.com. I'm your host, Sarah Troy, and my guest today is Douglas Slakey. Here we go. Slakey, MD, MPH. He's got all those initials behind him. So therefore, we're going to be talking about healthcare today and how to improve it in a complex world with The Process Manifesto, a book that we're going to be talking about that he's written, very much needed. But, just before we started this show here today, we were talking about the health world and the strain on doctors and nurses and the shortages around the world and the cost to become a doctor and how hard it is actually to be a practitioner in today's world. So there's a lot that is going on in the world that needs to be reviewed and renewed. And I mean, there's a lot that we can do about our own health. This is why the show is called Your Health is Your Choice, because sometimes maybe we don't need a doctor, we need other type of health practitioner to help us along the way. But we do have to take our health into our own hands. And if we can't find what we need to search a little deeper. He says each of us will be both patient and caregiver at some point in their lives. We all want healthcare system that supports everyone. And in the Process Manifesto, guides caregivers, patients, healthcare organizations to obtain the best clinical outcomes with respect and this big word, compassion. Despite remarkable medical advances, knowledge, and training, patient care remains fragmented, frustrating, expensive, and especially for the patient's perspective. Solutions for caregivers, especially for those on the front lines, remains elusive. This book helps them to demystify the complex reality of the healthcare system. It provides the tools to empower people and the teams to provide the most effective and safe and reliable care. Oh, God, do we need that? Welcome to the show, Dirk.
Well, thank you for that wonderful introduction. It's just really a pleasure to be on the show and talking about healthcare from the patient's perspective. I think that we lose sight of the fact so often when we look at improving healthcare. What does the patient really need? And what's their journey like? I think the context from the patient's perspective is so incredibly important. And, when we think, Sarah, about context in healthcare, we can think of everything from social determinants of health. How much money or education or where does a patient live? Do they have transportation? Um, those are really important aspects of care. But context goes beyond that. Context really includes, from the patient's perspective, what do they hope to get from their care?
Yeah.
What are their objectives? What do they want to run marathons, or do they want to be able to
Be
see
able to
their
walk up the stairs.
grandchildren? Yeah. Yeah. And many times the healthcare system, although it's trying to do the right thing,
Mm.
rigid rules and policies and procedures tend to try to force every patient into a common construct, like we're on an assembly line.
Yes.
And
Oh, gosh,
and
yes.
and patients, as we all know, we're not cars on an assembly line. We're individuals with our own histories, realities, and needs.
Very often when you go to a doctor, they expect you to know already what's wrong, right?
Yes.
Like when you do take your car in, I'm hearing a ding. Where is it? Well, it's coming from somewhere over there, but I'm not quite sure what it is. We're not meant to know. We're not the mechanics. We're not the doctors. All we know that it hurts here. but that actually doesn't even mean it's an indication of that's what's wrong. It could be somewhere else. And doctors don't give you the time anymore because, as you said, it's become the assembly line. Next, next,
Yeah.
next. And, back in the day, God, I did a show like this yesterday back in the day. I'm making myself feel so old. But, you at least had 10 minutes with your doctor. Well, how are you feeling? What are you feeling? Where is it hurting? What are you doing right now that this is causing this? And a doctor would kind of diagnose by asking you questions. They don't have the time for that now. There's too many patients on the roster. And as you said, it's so costly to be a doctor. They also have the cost of the premises that they're running from, which here in BC, in Canada, they are looking at reducing or subsidizing their rentals wherever they are because the cost of any property has gone up so incredibly high. They couldn't afford the premises in which to work from. Right. So
Yes.
all of these costs, cost as in the long run. And quite honestly, it's the entire system that has completely gone out of whack. And I think what it needs to be is let's go right back to the beginning and get on what do patients need? What do doctors need to serve their patients? And how can we bring this about in the beautiful word that you use, compassionately?
Yes. Well, you're right. There are so many layers to it, and I think the fundamental premise, as I did my work both in the Western world and in emerging market countries, looking at and thinking about how can we help teams improve their performance and
Mm-hmm.
empower teams. And at the same time, how can we help patients understand how to access the healthcare system and how to derive value from it? Well, really, I started thinking that we are in a complex system.
Mm-hmm.
And when you're really dealing with complexity, the first thing you have to do is honestly acknowledge it and say, if I'm in a complex environment, I can't hope to control it all. That is really where I believe we have to start. Unfortunately, uh, some of it's historical.
Mm-hmm.
As you know, I'm a surgeon, and
Mm-hmm.
we're trained as surgeons that we can fix everything,
Right.
and that's sort of the philosophy. And the healthcare system, especially in the Western world, has largely taken that as a foundation that we can fix something. And we've actually, in many ways, unfortunately, um, told patients that we can fix everything. And then when we can't, it's
Yeah.
considered a failure. Well, that's the first part of complexity. The other part of complexity that I think we really have to acknowledge is that for everything we do, there can be unintended consequences.
Mm-hmm.
Some people call it the butterfly effect, which is sort of interesting historically. And this is very timely. It was actually coined by a professor of uh, weather science back in the 1960s named Lorentz. And he was looking at little tiny changes in predictive models of the weather, and
Right.
they could have huge unintended consequences. And when we think about something complex like healthcare, we can really see that, right? Like we
Mm-hmm.
give the same medication to two different patients. One does well, another may have an allergic reaction and really not have the expected result of that medication at all. And if we don't have a system that can accommodate to those individual variabilities that
Yeah.
are inevitable, many times we don't see success.
Mm-hmm.
Um, and that frustrates everybody. It frustrates the people on the front lines who want to provide care. And it also obviously frustrates the patients and their caregivers at home and in their own communities.
Yeah. I think a lot of what has happened is, going back to what you're saying, you can fix everything. And, for a long time, it's like doctors can fix everything. Well, you're fallible as well, but, you're human as well. And you can come across a situation that just simply cannot be fixed. in the manner that you're used to, and it needs more investigation, or it needs a different approach. It needs a better understanding. Why has this worked on one and not on the other? What is the complexity of this person that it's not working on? So then we look at here, human beings as more multi-layered, as rather than just this situation. I know that from, patients' point of view, many patients feel that they're not treated as a whole anymore. That they're
Yes.
treated as this is the problem, and like a slice of you, right? And not the whole of you. And as patients feel that if you heard, how I feel on a daily basis and when I'm in pain and when I'm in not, you may be able to better deduce what the problem is. But there isn't the time to listen, or that there is, in some cases, I'm sorry, I'm going to have to say this, there's this, in some cases, the doctors, I know best,
Yes.
right? And not listening to the patient who's living with it, right? Who knows what works and what doesn't work. So I think we need to kind of look at not only the system and the way that needs to change, but we also need the system to hear the patients of really, though they can't talk medical to you because they're not medical, right?
Yes.
They can talk pain to you. They can talk discomfort to you. They can talk, it hurts here when I do that to you, but they can't talk, the medical terms. And I'm sure actually when doctors get sick, they're probably, another doctor's worst patient
Yes. Well,
because they're diagnosing themselves all the time.
that's true. And doctors, family members too, it can
Yes.
always be a problem. Well, I think part of the challenge, and this is where thinking about process is so important. Part of the challenge is with the hyper specialization
Mm,
that has taken place. And some of it was inevitable because science is moving so
yeah,
rapidly at an accelerating rate that it's humanly impossible for any person to know everything.
right.
It's just not feasible. And so some of the traditional anecdotal ways that we looked at medicine, while they're very appealing, we have to realize that the overall amount of knowledge was much smaller at the time. I can
Mm.
think even when I was in training, there, and it seems like a long time ago some days, but there were still my mentors who had, trained in the Vietnam
Mhm.
War and in that era, and they didn't even carry pagers. You had to try to reach them by telephone. And yeah, we think back, it really wasn't that long ago that the
No.
iPhone came to reality, right? Now we take it for granted, but
Mhm.
15 years ago, that just didn't exist in the way it does today. And so even the idea of instant communication wasn't there. Now, one of the things that I think is really important as we think about process design and implementation is we have traditionally looked at our healthcare processes from the perspective of the specialty of the provider.
Mm.
So and this is true even for primary care, which they have a broad field, but they focus on certain things, cardiologists, surgeons, everybody has their own sphere of
Mhm.
knowledge and influence. And unfortunately, the processes have been set up where the patient has to go through these fragmented components
Yes.
of
Yes.
care. And each provider group looks at a specific, and you said it perfectly, just a specific fragment of the patient,
Mhm.
but doesn't always put it
Yeah.
into the context of the whole.
Right.
And that's so important. I'll tell you one story about a patient of mine years and years ago that when I was in New Orleans in Louisiana, and we had a patient that we did a liver transplant on. And every time she came to clinic, she was extremely put together and, looked well dressed, was very conversant. but she kept getting infections after infection after infection. And we couldn't really understand why. And of course, we have a big team. We have social workers and nurses and doctors and hepatologists. And it was very frustrating because she should have been doing much better. Her liver that we had transplanted was working great. Well, there was one day where my wife and I were visiting some friends in rural Louisiana, very small farming communities. And I knew that this patient lived nearby. So we drove by just to knock on her door. Not that we all do home
No,
visits in,
that's a thing of
in
the
the
past,
United
that's for
no
sure.
in the United States, but we had become acquainted, and so we drove by, and that this was so striking to me because she lived and and as I said, we had this amazing team and we thought we knew everything about this patient, but she lived in this extremely rural, poverty ridden area. She lived honestly in a small shack that in a wealthy neighborhood might have been a garden shed.
Wow.
And she didn't happen to be home at that time, but as I got back in the car, I was thinking to myself, now I understand why she's getting infections, which I had no idea before. We just kept treating them with ever
Yeah,
stronger antibiotics.
yeah.
And the other thing I really thought about was we don't really understand our patients.
No, no.
And it's so important because you can do something fantastic like a liver transplant.
Yeah.
But if you don't really understand the patient as a human being, it's hard to really optimize their healthcare and truly understand their needs and their aspirations and the realities of
Yes.
their existence.
You have to look at them as a whole,
Yes.
right? Not as a product either. And the other really important thing is the emotional aspect of healing, right? Now, medical takes care of medical, but where's the emotional aspect of it? Where is the trauma aspect of it? Where is the support of the lifestyle change that has to happen?
Yes.
My brother lives in England. He's had two heart attacks. His last one, we had a whole load of stents put in. He has prostate problems and he has kidney problems. And he goes from one doctor to the other, and they put this stuff in him that destroys your immune system,
Ah.
right? So he's not even allowed a vitamin C for the next 5 years, which I'm sorry. I just, for me, your immune system works for you. If you're killing your immune system and you're not supporting it, how is it going to protect you? I don't get that. I'm sorry, I don't.
Right.
But that doctor is not talking to the kidney doctor or the heart doctor, and they don't do things where they write it all down on one program that can be sent to everyone. They do it by letter,
Yes.
right? And it's like, he went to see one doctor. I want to put you on this drug, and he says, "But I've already done that drug." Oh yeah, no, I guess you can't go on it then. Like, because nobody was talking to each other.
Right.
That's scary because
Well, yes.
you're talking about that fragmentation of just being passed along the conveyor belt there for the next person to deal with, and nobody's communicating or treating as a whole.
Yes, that's so true. The optimist in me is looking now and at how can we actually transform that
Hmm.
in a way that really puts the emphasis on that patient journey. And
Yes.
I believe that we're at the cusp of some really exciting transformation that will enable us to empower people to use their judgment, skill, and training more effectively. And one of the ways is actually to use technology. Yeah, it can be scary.
AI,
As
are we talking?
I, AI,
Yeah, I'm for
deep
it.
learning, but what we need to do is not remove the human
No.
aspect, but we need to
Yes.
support the
Yes.
human. When you think about nowadays, we drive our cars, right? And
Mm-hmm.
we all rely on things like Google Maps or
Yes.
Waze or something like that. And the important thing to know is that we're not just getting data when we're using those, we're getting information.
Mm-hmm.
And there's a lot of data behind that, looking at what are the average speeds, where are the accidents, where might a road be closed, or something like this. We're not knowing all that necessarily, but it's guiding us
Yes.
on our journey in the car. And the thing that I emphasize when I talk to teams and they're skeptical, they're saying, oh, that's going to further remove the doctor
Mm.
patient relationship. Well, I say, actually, it'll support it, because
Yes.
we're not going to, if we do this correctly, we're not going to force you. The technology isn't going to force decision making down a specific pathway, just like the Google Maps or
Yeah.
Waze. It doesn't make us turn to the right
Right.
or the left. We still have our eyes, our ears, our senses, our judgment. And if it doesn't look right, we can turn the opposite way, or we can
Exactly.
continue to go straight if we think it's a safer pathway. And I think this is where we're really going to have some
Yeah.
impact.
Yeah.
The other thing I think, which is going to be very important, and you and I touched on this before we started the conversation, was the shortage
Mm-hmm.
of primary care and the difficulty in accessing it. Well, things like remote patient monitoring are going to be so important.
Yeah.
And the key here, one of the keys, I think, is really understanding where are patients doing well and they don't need an intervention. But on the other hand, those patients that do need an intervention but might not recognize it,
Mm-hmm.
how can we impact that? And how can we promote their wellness
Mm-hmm.
instead of waiting till there's some
Yes. Until they're sick.
significant
Yes.
sickness that we
Yes.
need
Oh,
to address?
amen to that. Amen to that. And I know a lot of people are obviously petrified of AI, they how many centuries have we been talking about the robot is going to take over? It already has phone. It's called a phone, right?
Yeah,
It's already ruling our lives. And it is up to us to be discerning. But as you've said, information allows us to take more concise action.
yeah,
We are human beings, we have a great brain, but we can't carry it all. Also, we can't do it at the speed an AI can. And if an AI is obviously properly fed all the medical that is needed to go, and you can present X, Y, and Z, symptoms, or this is showing, that showing, they can deduce so much faster. You can agree or disagree. You can go, oh no, but I can look here now, I can look there now, or I can see this differently. It is an assistant. It is an assistant, right? They can
right.
deduce things so much faster. And as you say, it can be something that can follow up on patients as well. You know, how are you feeling this week? Fill out this questionnaire or answer it. Have a voice
Yeah.
behind it. And you're answering it back. That can then go into the system for the doctor to assess, right? Or
Yes.
somebody else to assess. Why are we not? We look at technology, look at the technology advancements that you have in your surgery today compared to 10, 20, 30 years ago, right? From the
True.
time that you were being taught from the doctors from the Korea War, well, what did they have to do surgery in? A tent, for goodness sake. And lucky if they had a light bulb, right?
Yes.
You've got all sorts of equipment today. Do people buck that equipment? No.
Well, yeah, so here's an interesting aspect of technology and equipment and advancement, is that we don't always, in my opinion, commit enough time and resources to training
Right.
and continuing the education of people. Unfortunately, often we use trial and error to really see if things work. And if we believe in high reliability and we want And high reliability is so important. It's the idea that as a patient, as a consumer, you're going to your healthcare system and you believe that you're going to be receiving the best care. Just like if if I was going to go to the airport today and
Yeah.
I was fortunate enough, let's say, to be flying to London or Paris or something, I don't really care what the airline is.
Mm,
I have no idea who the pilot is,
right.
right? But but as a consumer, as a flyer, I have great confidence in the
Mm,
reliability of that system. And,
hmm
in general, the safety results and the ease of flying have shown us how the technology can actually
Yeah.
work, but they continually train and educate people to use it. Um, Whereas in healthcare, there has been historically this idea that once we finish our training, our residency, or our fellowship, it's automatically that's all we really need to do. We can go to a conference once or twice a year, which may or may not give us new insight. And the other thing, Sarah, is that we don't train consistently as teams,
No.
which is really crazy, right? Like when you think
Yes.
about it, so you're the patient coming in here, and I'm the surgeon, and I have my nurses in the operating theater or different places. Well, we don't really train together to try the technology prior to a patient coming in. We just do it in the middle of the operation and to say,
Yes.
well, here's this new technology. And sometimes there'll be a representative from the device manufacturer in the room, and they'll say, well, you kind of put the instrument together this way and just squeeze the handle
God,
3 times.
that's
And you
scary.
no, it's terrifying, right?
No wonder
Like,
the patient needs to be asleep.
no, I know. Well, just imagine going back to that airline analogy. Imagine if you were, on that flight, you're sitting at the gate, you just got on the plane and you overhear the pilot say, well, gosh, I went to this convention and I just got this new GPS and let's put it in and see if it works.
Yes,
That
yes.
would never happen. So,
Yeah,
so what one of the things I think is so important that I really emphasize is that we need to have meaningful training and education. And as part of that training and education, we need to incorporate feedback from real, actual patients
yes.
who point out where things went well,
Mm.
where things failed or could have gone better. And then how do we use that to um, really focus
Improve or
our,
pivot, you know?
yeah,
Yeah,
pivot and
yeah.
focus on improvement.
Yes.
So important. And
For both sides of the coin, though, it's not just,
yes,
for the patient, it's also for the doctor, because obviously a well patient, it's like a chef who gives a great meal and the person goes away with a smile on their tummy and their face, it's, that was a good meal. I've sent them away happy. A doctor wants to know the patient is healed or is
yes,
healing, right? Because it's not just, well, there's another success notch. It is, that's the reason why I think you went into medicine in the first place, was to give people back their lives, give people
yes.
back their health. And if there's a system in place that supports the doctor, that he can then be the supportive of the patient, then what we're seeing is far more success happening where everybody's got the smile on the face.
Yes, so true. And that, that gets us into this whole idea of compassion
Mm-hmm.
as one of the core aspects of when we look at processes. It's fascinating, right? Like if you think of processes, going back to that assembly line analogy, as a very linear um, construct. Well, that does two things. It can standardize care, which might be good in some instances. But on the other hand, we tend to look at the performance then as steps within the process. Did we get the patient in and out of the room fast enough? Did we get the electronic medical record signed fast enough? While those things may be important in and of themselves, they might not really reflect on how the patient
Yes.
feels
Yeah.
and whether the patient actually is improved. And so it goes back, there was one of the gurus of the last century of quality improvement was named Deming, and he did a lot of work with the automobile and other industries. But one of his focuses that he taught people was that when you're building something like a car, the important things aren't really how fast each step of the assembly line works. The important thing is, does the consumer at the end of the day have a car which is reliable, that they want to buy, that they can get in and feel safe and comfortable in? Well, it's the same with healthcare, right?
Yes,
Like
yes.
if, and what we have to do at some point, there's the frontline providers, the nurses, the doctors, the physical therapists, dietitians. They need to be in an environment which allows them to be empowered, to use their professional skill and judgment to treat the patient like a person. And what we
Please.
have to do as part of, as part of our improvement, we have to think about how do we also educate the managers and the leaders?
Oh, I was going to say, what about the accountants?
Yes.
Because everybody feels the accountants are running the hospital and it's not about the patients at all.
I think unfortunately that's true, and there's a disconnect.
Total.
You
It
have to
doesn't seem to be
acknowledge.
a life for human business. It seems to be just purely economics.
Yes. Yeah, in so many ways. And one of the challenges there is, if we're just looking, for example, let's just take the economics of it. If we're just looking at the economics out without the context of the patient, sometimes we don't see how improving patient care can actually be a positive
Yes.
on
They
the
don't, they're
economic
not
side.
a revolving door.
Right, right.
Right?
I,
Yeah.
I'll tell you another story which was so interesting. I had put together a team at one of the health systems I worked at, and we were looking at quality improvement processes from the patient's perspective. And we had done a pilot study for elective spine surgeries, and and we put these processes together, which actually did two things. It diverted quite a number of patients away from surgery to non-surgical intervention, and we had great patient engagement and success. And we did that just by changing the referral patterns and the way teams work together. But here was one of the most eye-opening things to me. We also looked at processes that improved the care after surgery. So shorter length of stay, less complications, less blood transfusions. And we went in and presented this, and there was a small cost involved. Every hospital in the system needed a nurse specialist to guide the patients. Well, we sat down with a chief financial officer, and he said, great presentation. I love the work. But at the individual hospital level, the finance people will look at this as just an increased cost, and they won't see the benefit, because the benefit of the improved patient care is really seen by the insurance provider, because they're not paying for the complications. At
Right.
the hospital level, our improvement could actually be seen as a slight increase in cost and then reducing revenue, because these patients weren't coming back for costly additional care. So this is just, yeah. And
What?
this is not an isolated
No, no.
example. And it's very, well,
Frustrating?
complex, but it's an example of where to make improvements, we first of all have to think from the patient's perspective what's
Yes.
best. And then we have to try to align the different stakeholders to all see the benefit of that renewed, compassionate focus on the patient.
They've forgotten what business they're in.
Yes,
They really truly have. They've forgotten you're talking about life. You're talking
yes,
about the quality of life. You're talking about when people are healthy, they're inner wealthy, and now they can be create, right? People can't create from a sick place. They've got to be inner wealth to create and to be productive out there in the world. If they're
yes,
sick and they're perpetually sick, they're a drain, right? No fault of their own, they're a drain. But if pharmaceutical, what is their business? It's to keep you sick. They make profit if you're sick, and that's the bottom line of it, right? They're not in the human health business. They're in their pocketbook wealth business, and everybody knows that. And sadly, they are the lobbyists. They're the people behind the politicians and all of that. So that is just absolute fact. But when hospitals don't put the well-beingness of the patients first because the insurance companies are just looking at their bottom dollar. I mean, quite honestly, there needs to be a law of looking at the insurance businesses and saying to them, get into the human business because
yes.
you're not. You don't give a damn about humanity. It's all about your bottom dollar. And every patient knows it. And so does every practitioner, right?
Yes, yeah. Unfortunately, I think that yeah, that's definitely the perception. Obviously, there are people within these different industries who are trying their best
I know, well, they're up
to,
against, they're up against a giant, and it's time you had a Goliath out there.
yeah, yeah, it is. And so one of the things that I think is yeah, there's this idea of learned helplessness where
Mm,
um, and this is true. Unfortunately, we're seeing this on the front lines of healthcare. We talk about burnout.
yes.
Um, it's very unfortunate when you look at the statistics of suicide in the
Mm,
healthcare provider now with nurses and doctors. And, this started to go up during the COVID pandemic, but it has not abated. And I believe that there's good evidence that much of this is due to the frustration that people feel like they're in this intransient system that just doesn't,
care.
as you mentioned, doesn't allow for the human
No.
connection.
Hmm.
And so many people have just thrown their hands up and said, well, I
Hmm.
can't change it. There's nothing I can do. I'm just going to go to work every day and just keep my head down and be quiet and do my job, clock in and clock out sort of thing. And somehow we have to inspire people to say, well, you can make a difference. And one of the things that you mentioned in the introduction that I came up with in the book was this whole concept that, it really is a continuum. Every single one of us as a human being is at some point in our lives a patient, and at
Yes.
some point in our lives a caregiver. And as I really reflected on that thought, I said, that's really powerful. And if we can get that message to resonate with people and to inspire people to think, gosh, this is about human beings, and it is
Hmm.
about being compassionate to others, and it is about optimizing people's health so that they can be the most productive, as you
Yes.
mentioned, in
Yes.
society as
Yes.
they can be. I think, um, yeah, you know, the truth is we all have aspirations
Hmm.
and goals at every stage in our life. And so much of achieving those goals has to do with our health.
Absolutely.
Um,
Hmm.
and
If you don't have the health, you don't have the energy to pursue those goals, right?
no,
And so,
no.
the health is so essential to our productivity as human beings. You know, we're all here in service of one another. How can I be of service if I can't even serve myself? If I can't even help myself? And, you know, I think also we look to our doctors, our nurses, the whole medical system to fix us. And what we've got to understand is we have to take some ownership ourselves. You know, our health is our choice. What are we doing? Is our lifestyle being detriment to us? You know, are we putting ourselves in too much stress? You know, what about our diet? Boy, is that a huge one. You
Yes.
know, so much of our dis-ease in life becomes disease in life. And so we run to the doctor and say, fix me. But, you know, ultimately, where is our accountability as well? So I think when you do have a medical practitioner that you have, it is, you know, two-way street where, you know, the doctor can suggest this, that, etc., but you have got to be a participant
You
that
do.
is going to be interactive in your own life, in your own healing. And it's not just about another drug or another op or another this or that. It's like, what are you going to do about it?
Yes. Yeah. Well, that is such a great point. And I think, so I thought about this from the perspective of how do we start to empower patients to take accountability for
Mm-hmm.
their own health and, yeah, to do things like trying to ameliorate stress or
Mm-hmm.
exercising or eating a healthy diet as opposed to stopping off to grab the fast food because it's
You're
convenient.
right. All the
You
processed
can't,
chemicals.
yeah, yeah, right. Well, you can't say it's the cheapest anymore because
No.
those
Oh,
prices have gone up.
God, yes.
But one of the things that I think, again, looking at what can be transformational, one of the things that I think would be a tremendous step towards those goals is to actually make the patient the repository of their health information. When
Mm-hmm.
you think about it now, everyone else, the system, owns our health data and our health
Yes.
information.
Yes.
Now, it's true that the electronic health record has portals that we can log into and see certain things, but we can't see everything. We can only see what's been released to us. And often it's not presented in a context that, as a layperson, we can really understand or use. And this is so different than other industries, right?
Mm-hmm.
Like imagine if a bank treated you the way the healthcare system does and says, well, gosh, Doug Slakey, we have all your finances and you have to fill out this paperwork to take any money out
I
because it's
know.
not really yours, it's ours. So think about this. If we change that, if we
Mm.
transformed it to where the patient actually had control of their health information, and if a doctor or a hospital or an insurance company wanted to see it, they had to ask you explicitly for permission.
Yes. It's the other way around completely
It's
right now. I
it's the
don't
other
have a
way.
doctor right now. I have to pay to have my medical records moved over to another doctor. But as I actually don't have a doctor, because there's a million people in BC without doctors right now, I don't have any access to it whatsoever. But there was one time I had a claim in an accident and I had to buy my medical. And I actually read some of the things that my doctor said about me. And
Oh no.
I no, I was astonished. I was astonished. I thought, because you know, we've got to remember this is a trust factor.
Yes.
When you're going to your doctor and you're revealing how you feel, and they're not just treating your body, they're treating your well-beingness. And then you read something afterwards and comments that they've made, and you feel, God, that's a break of trust. That is, you know, they feel this way about you, yet they'll see you as a patient, and it felt like such a betrayal. So I think actually having openness there, you know whether the doctor is in sync with you or not. Yeah, it's
Yes.
time to change doctor. This doctor clearly doesn't get what I'm saying.
Well,
right? You know?
they don't get what you're saying, and maybe like the illustration I gave about the patient in rural
Yes,
Louisiana,
yes,
maybe they just don't know,
right.
and they don't have time to know you, and there could be, different reasons, but you're absolutely right. And the other thing that we really have to consider is how in those examples bias plays a role.
Mm-hmm.
I mean, we all have biases, right? We all come into situations with certain perspectives and certain histories that color our view of the world and other people, whether it's right or wrong, justified or not. Well, that is often the case. I would say maybe always the case in healthcare too. There are biases.
Mm-hmm.
And, we look at patients, for example, and we think, oh, they have an addictive personality. Nothing I can do for them. They're going to just do what they want to do, or they're lazy, or
Mm-hmm.
they're overweight because they eat too much and they don't exercise. So maybe I can give them a drug now, a
Yeah.
shot, and then I don't have to, think about whether I should talk to them about exercise or eating better. I'll just give them a shot. It'll quote unquote fix it, and they're on their way. I don't have to worry about them. And, those are all colored, all those decisions are colored with bias that we have to really understand and recognize the influence that bias has. I
Mm.
think,
I'd like to actually add a case in point to that because actually during this time with this particular doctor, I was looking at more into alternative health, getting in more into nutrients and vitamins and things like this that could help my body because I had reached a bottom low. And I was telling him about echinacea one day, and
yeah,
his actual comment to me was like, all this stuff, you're just going to put us doctors out of business. And I thought, but where's the integration of working with things that have been around for thousands of years? Now, the interesting thing is I hadn't seen him for at least 6 or 7 months, and I'd gone in with my daughter. I had lost weight. I was looking healthy, right? And he goes, I haven't seen you. I said, no, I've been healthy. So maybe he had case in point. But then he started talking to me about nutrients.
oh,
Right. So it's realizing that, yes, you've learned the medical, but don't feel that's the be all and the end all.
right.
That even if you don't know, I had a wonderful doctor that she used to, my ex-husband's Chinese, and she said, this is what's wrong with you, has he got any Chinese medicine for you? Because it's the integrating of other solutions, and this is where we need to be proactive. If that in the doctors can only do maybe so much for you, what can you
Yes,
do for yourself? And that means, it's not looking outside of the box. These medicines have been around for thousands of years. There is no box, right? How can you work
right.
together?
Yes, that is such a great example, and it's so true. And unfortunately, I think some of the barriers or challenges go back to your previous comment about the way the healthcare system
Hmm.
is driven by money,
Yes.
and these interactions between the different components. It's interesting. Um, I was speaking with somebody who's very engaged in thought leadership and sort of governmental healthcare issues. And we were talking about the term value in healthcare. What really does that mean, and what is value? I
Yeah.
said, well, we say it's better outcomes with spending less money or managing the money. But one of the challenges is that at every level of our healthcare system, one person's waste is another person's profit.
Hmm.
And and that was an eye opener for
Yeah.
me, because I realized that yes, there truly are some perverse incentives that are misaligned, and and create these conflicts in the way we look at delivering healthcare for people.
Yeah.
And your comment from the one doctor saying, well, if you focus on nutrition and exercise, you'll put us out of
Yeah.
business. you know Obviously that's a bit tongue in cheek. It's not 100% true, but isn't that what we should aspire for, is
Yes.
patients to
not need you.
not, yeah,
Because there's always somebody else that needs you. If you're
yes,
reliant on just a few patients and you don't want them to be well because you're going to lose income, it's about, how about you look at the conveyor belt of turning out well people? More sick
yeah,
people will want to come to you because you turn out well people.
such a good point. That should actually be a billboard that that they put up and really advertise, because that philosophy is so important when we think about what are the outcomes we're trying to achieve,
Yeah,
and what do we really, how do we move from this idea that we're just going to use a pill or a
yeah,
procedure to fix a symptom,
yes,
as opposed to making the person healthier, more successful, and able to really cope. And this is another important thing,
mm,
is to cope with their daily life,
yeah,
and as we think about populations aging and other challenges like that, we have to understand that context, getting back to the original
yes,
comment about the context of the person, and and be honest
yeah,
with them, right? What are our shared objectives and goals in making you as a human being as healthy as possible?
yeah.
And
26
that,
years ago, I was diagnosed with fibromyalgia.
hmm,
And at that time, nobody knew what it was. I mean, I probably had it for already a few years before they even kind of understood what the diagnosis was. And it was only a few years later I ended up with a doctor that had studied it for 20 years and became the doctor.
oh,
Where other doctors go to actually understand what it is, and to understand that it's a disease that is managed because there's so many points under an umbrella. It's not any one thing, right?
true.
And that it's something that one has to manage. But what he did with his patients, he'd take them through workshops, he would take them through one-on-one counseling, he would
Oh,
take them through how to manage it, when to listen to your triggers, how to pay attention. And as I say, I partnership with my disease, right? It has a voice when it says to me, uh-uh, you're doing too much, right? You stop right now, or you're just going to be the old wackaroo, right? And you learn to listen and you focus on what you can do, not what you can't do, but you learn to know when you have your limits. And I think we don't get that kind of training from a page, from a doctor. You have, I don't know how many people that I've interviewed have had cancer. Well, you have cancer. Yeah, we have to cut it out. We have to do this and that. And it's like, where's the management?
yeah,
Where's the helping you be a part of your own healing? These are the things we can empower you to do, right, while you're going
yes.
through this process. And we don't see that side of things. And I think that's what's desperately missing and why people are not getting well, because, that human soul, heart, spirit aspect of it is being left out.
Yes, well, I think so. And what, unless we look at the philosophy of care from the perspective of wellness, and I think you described it perfectly, the listening to your body and your signs and symptoms, what can you do? And that, and that's going to vary by the person, right?
Yes. Yes.
So you talk about something like cancer, and um, it's so different in the way each patient sees that
Hmm.
diagnosis and the way they manage it. Um, and the healthcare system now, it's interesting. I mean, it's miraculous, some of the advances, no question about it.
Yeah.
But on the other hand, some of those advances have pushed the care responsibility out of the facility
Hmm.
without the scaffolding or support
Yes.
network that the patient really needs. So,
Yes.
I mean, it was just Breast Cancer Awareness Month, and you think of, patients, for example, having a bilateral mastectomy, and they stay one night in the hospital, and they come out to go home with 4 drains and this diagnosis, which is life-changing. And where's the support to handle that? And when the patient goes home, how are they supposed to take care of those 4 drains coming out of their skin? And the fact that,
Especially they may have a family that,
yeah,
is demanding of them, etc. Yes.
well, right. And the ages are changing now.
Hmm.
So, in that example, there's some young women
Hmm.
that might have toddlers or
Yes.
school-age children on occasion, and then they're told, like, here's a great example. You operate on a patient for some reason, and they have a 18-month-old at home, and you tell
Yeah.
them, well, you can't lift
Yes.
10 pounds for 6 weeks. Well, that's just simply not going to
Um,
work,
no,
you
no.
know? So you have to figure out, okay, well, how do you accommodate for that?
Hmm.
And how do you come to a relationship with your patient that acknowledges their realities
Yeah.
and gives them a way and a strategy to have the best chance of a successful outcome? Those are so important, and we we're just scratching the surface of understanding that,
But you,
how to
you said it
approach
earlier.
things.
You said it earlier about this whole system of having an extra nurse that helps people through a particular thing. If people had after op care or after hospital care, they're going to get better, faster, and
Yes.
more thoroughly because they've got the support in hand, right? If you're sending them home without that support, guaranteed something is going to go. So, drain's going to come out. You're going to pick people up. It's like when you have a C-section, you
Yeah.
can't lift your baby now. Well, hello? Yeah.
Right.
Or your toddler running around or anything else, and I ripped my stitches when I had a C-section because, it was not realistic, right? And that's the thing of why are we not looking at from diagnosis to basically either cure or you are well enough now, right? And being that support system all the way through.
Yes. Well, yeah, so I call that the patient journey
Hmm.
from um, diagnosis, and then it should be a shared, agreed to plan for treatment. And then the end of the patient journey, I sort of like to think of as functional recovery,
Hmm.
whatever that means for the individual patient, right?
Yes.
And that's going to be different for by individual, but that whole patient journey, providing the support and the resources to do 2 things is critical. One is to ensure that we're providing the care which matches the expected patient needs. So
Yeah.
that's the first thing. So, it could be surgery, it could be medications, it could be exercise, physical therapy, a combination of all those. But equally important is we have to have a support framework which allows us to recognize when the patient's journey is not going according to plan.
Right. Yes.
And how can we intervene early to get things back on course?
Hmm.
And that's critical, right? Like going back to sort of maybe the drain analogy or pulling the stitches. Well, we wait until there's a problem,
Right.
and then we say, and on the physician side, you realize it's usually Friday at 7 p.m. or something like that.
Yes.
And then
Wait
the
until
pa-
Monday.
yeah, the patient calls, and you say, well, you'll have to come into the emergency room.
Yep.
And if we had mechanisms,
Hmm.
even if they're not perfect, but if we had mechanisms to ensure that there was engagement and there were ideas. So that I've been looking into some of these remote patient monitoring technologies, and they're really fascinating, and they come in a variety of forms. Some of them are engagement, like in apps, and they can actually, by questioning, by sending simple questionnaires, they can predict whether a patient needs additional
Yes.
resources or if they're doing fine. There are even, it's amazing now with the smartphones, there are even technologies where we're starting to be able to assess things like pulse and
Yes.
temperature and
Blood
blood
pressure.
pressure.
Yeah.
And then also, there are apps coming out now which, just by listening to your voice, can interpret things like anxiety or
Mm.
depression. And
Stitch in time.
yes,
Yeah, stitch in time saves nine. Catch it right there
catch it early.
before it becomes an issue. Yeah.
Yeah, but before it becomes a crisis,
Yes.
we
Yes.
want to prevent
Yes.
problems and provide guidance and resources. And one of the challenges with the way we've looked at these assembly line processes is, to the degree possible, we have had this philosophy where we can just push as many resources as the budget will allow to every patient equally and hope for the best, sort of a
Mm.
shotgun approach.
Mm.
Well, there's two problems with that. One is that we clearly don't have enough money to do everything for every person.
Right.
We don't have enough. So that creates disparities. And the second problem with that is we don't effectively think about what are the resources we need to align with different people at
Mm.
different times during their healthcare journey. So, for example, there are some people who live in areas where they just don't have reliable transportation for
Mm.
one reason or another. Or they may live in a food desert, which unfortunately are surprisingly common in some of our large cities, where they just don't have access to fresh, wholesome food the
Mm.
way you might in a wealthy suburb.
Right.
And so, instead of saying, well, every patient just needs to be handed a paper saying, here, eat healthy, maybe
Right.
we need to think about which patients, especially if they're recovering from a
Right.
surgery and they need extra nutrition, which patients would benefit most from us providing some intervention. And on the other hand, which patients can we comfortably say, gosh, they have a supportive family,
Yes.
they have a great
Yes.
environment, they might not need all these resources. And that's part of managing complexity,
Yeah.
right? That's part of admitting that not every human being is exactly the same, and not every two patients respond the same to every medication or every treatment.
Right.
So we have to put that into the context of how we're providing care.
I mean, we've also got to take down all the different ethnicities that are out there, the different cultures, the different diets, the different approaches. And,
Yes.
we treat everybody as, the white people. And that means that, yeah, everybody's going to be the same. And it isn't. They may have all the same organs, but, their DNA is slightly different in the sense of their ethnicity and or their approach to their own health or their diet or their recovery.
Yeah.
And again, it goes back to, are we listening to the patient of what they need or what they're comfortable with? Because if they're comfortable, they're going to participate. If they're uncomfortable, they're going to push back.
Yes.
So again, what you're talking about into the after op care or after treatment care that sees people right to the point where you're now well enough to stand on your own. All right. And
Right.
what does that mean? That means that person isn't going to get sick again the next week and come back, right? You've not only helped them through this process of healing, but you've also taught them how to prevent sickness, or when they feel something's coming along, how to be a part of their own healing as well. So you don't have that revolving door.
Yes, and to be proactive.
Yeah.
And so, yeah, two things I was thinking about as you were talking. One was you brought up, the different genetics and the DNA. That's so fundamentally important. And when you think about it, there's a great example of in the pharmaceutical world, where we know the enzymes that break down certain medications can be very different in different people.
Yeah.
And this was really fascinating in organ transplant, when we realized that certain groups of people had enzymes that would break down the anti-rejection medicines several times faster than other people. And what happens is that we give everyone basically the same, we select a dose, because
ADOS,
the
yes.
pill
Yeah.
comes in whatever milligrams, 500 milligrams. So we give everyone that dose. And we think
One
that
size fits all.
everyone's going to respond the same and get the same. And so as you were talking, I was thinking, well, one of the things that will be exciting is when we're able to really individualize the way we look at medications and
Yeah.
treatments for patients specifically.
Hmm.
So
Yeah.
that's going to be a big change. The other thing, slightly off topic, that I was thinking about as you were talking, and we're talking about wellness and people getting better, is that societally and in medicine, we must start to do a better job with incorporating meaningful mental health treatment
Yes.
into our
Yes.
care.
Yes. If
Uh,
the
uh,
mental health is not well, the rest of the body is going to be unwell.
no, well, that's so true. And there's
Mm.
so many stigmas. I'll tell you, there are even some really disturbing stigmas within the health profession. So um, a few years ago, I went to apply for a new state medical license, a different state where I hadn't practiced before. And I have I'm very fortunate. I have a spotless record, so it should be pretty straightforward. But I got a questionnaire, and on the questionnaire, there were some questions that sort of spoke to uh, the person. So they asked, for example, have you ever been convicted of a felony? Have you
Mhm.
ever been convicted of sexual harassment or something like that? And I'm like, okay, well, those questions,
Are
sure.
valid, yeah.
And right after the have you ever been convicted of a felony was a question, have you ever been diagnosed with any mental illness, including anxiety or depression? Well, so
Who hasn't
everybody,
had anxiety or depression
yeah.
at some point?
Well, I thought to myself as I read that, I said, this is coming from a medical board,
Right.
and we're putting a question about mental health. And this wasn't about, being a sociopath or
Right.
something like
Right.
that. It was like, have you ever had depression or anxiety? Um, so everyone who's filling out the form is probably going to check no, even if they
Right.
have. And do you know that the reality is many healthcare professionals who seek treatment for
Yes.
depression or anxiety, they don't go through their insurance. They do it
No,
off the books so that it won't be part of their medical record.
I know. Isn't
And
that a shame? Isn't that
it's
sinful?
such a shame.
Yeah.
But if we have this stigma within
Yes.
our own profession,
Yes. Yes.
how can we actually provide care in a meaningful, compassionate way to other people?
Exactly. But the fact that that question also comes out after, are you a criminal or sexual
Yeah.
deviant? And it's like, it's almost treating it as if it is a criminal act. Like,
Well,
what
right.
human being doesn't have anxiety,
Yeah.
right? Of some form. We all do,
Well,
right?
and they,
But what human being doesn't have depression? If a doctor who's had to sign so many death certificates through COVID doesn't have some form of depression, I don't want
I'd
to
be
know,
worried. Right.
right?
Right.
It's
Well,
yeah,
and
ridiculous.
yeah, and the other thing that really struck me about this was that they didn't ask questions like, do you have narcolepsy or do you have epilepsy?
Right.
And, when you think about it, honestly, as a proceduralist, like if you're
Mm,
in the midst of a complex surgery or putting a stent in someone's heart and you are prone to epilepsy, that might be more concerning, honestly,
Yes.
than if you had a little situational depression because you were in the ICU for months and months and months
Yeah.
treating COVID patients. And
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 then
it
where's the support for the physicians, though? I
right.
mean, there should be categorically across the board for every practitioner, nurse, anybody working in the hospitals, even at the janitors of how many, you know, people they're cleaning up of after they died, all of them should have that access
Yes.
without judgment.
Yes.
Without judgment, without persecution. Because what you're saying to them is, you're not allowed to be a human being on this level. We want you to be robotic and not feel anything. And on the other hand, we're saying, please be caring and loving towards the patients. Who's psychotic here now?
Yes, such a good point. It's truly a mixed message.
Yeah.
And yeah, there's many hospitals, and for ostensibly good reasons, they've started to talk about wellness, but they look at it sort of from the perspective of hot tub harmony. They think if they have free yogurt day once every 6 months, with somebody playing piano in the doctor's dining room, that's going to make everybody better. And that
Oh, come by,
yeah,
yeah.
but that's not really
Realistic.
realistic or the resources we need. And uh, as you said, it's really giving mixed messages. You
Mm,
expect people to be dissociated from the human
yeah,
side of what we're doing and to treat things, like you said, robotically or
yeah.
mechanically. And that gets back to this idea there again. It gets back to this idea of, well, if you put everything into a linear assembly line
Mm.
construct and you reduce everything to some very basic level,
Flesh,
yeah,
not
then you
human,
can
flesh,
yeah, then you can say,
organs.
okay, well, that might work, but it doesn't
Doesn't work. No.
work. And
It's not a meat market, you know, it's we're we're hearts and souls and spirits in these human fleshes. And you know what they're doing is just having you treat whatever the flesh problem is or whatever, you know, the organ problem is, and not look at you as a human being,
yes,
right? You're just an expense. The quicker you can fix them up and turn them on their way, the better. That's all it is.
yes, unfortunately, and for uh, going back to the brief discussion we had about accountants and things, unfortunately, from that perspective, you could be running a McDonald's franchise or
Mhm,
any other business,
mhm.
um, if you're willing to be that disconnected and and not think in terms of what what role in society and in the population or the community do we really have.
Yeah.
And really that's so important, right? Like why do we have a hospital in a community, or why do we have primary care
Mhm.
doctors? um, it's about improving the health of the community that's served
Yes.
ultimately. And that community is made up of individuals. So if we can improve the health of the population and the community by making every individual more successful and more empowered to be
Yeah.
part of their healthcare journey, well, then the whole community winds up thriving.
Healthy community is a wealthy community
Yes.
because everybody's got the energy, everybody's got, you know, the passion. I always say that the village is only as strong as everybody's participation.
Uh,
And if everybody looks out for each other and everybody's got their own role to play, and that village is there to support one another through thick and thin, then that village is strong. So in our
yes.
healthcare system, we want the village. We want the village that is there invested in us to be the best we can so we can turn that investment into someone else.
Yes, it's so true. And that's where the intersection of individual health and population health has to be appreciated.
Mm-hmm.
Um, it speaks to so many of the things that, you were talking about with the strength of the community. And we see that, right? Like in some of our large cities now, unfortunately, when we look at, for example, homeless populations,
Oh
and we
gosh,
know that
yes.
there's drug addiction and mental illness and some of these challenges that have a significant relationship to not thinking in terms of public health
Hmm.
as a component of the strength and health of the population, and by extension, the community, the city, the environment in which we live. It's so inextricably
Yeah,
intertwined,
it is. They're
you
not
know?
throwaway people. And this is kind of something that I talk about a great deal on my shows is that we've come, I don't know how we came here, but we've come to this space in time where people are just disposable. Lives are just disposable. We don't count. If we haven't got the followers, we haven't got the money, we haven't got the clout,
Yeah.
we're not important. And we've forgotten about what true enrichment is, what true abundance is. And it's an inside out job. It's a well beingness, stepping into your own beautiful gift of what you are here to do and here to be. And the more we fortify that in a human being, physically, mentally, spiritually, the more abundant they are and the more
Yes.
progressive and productive they are. We're shortchanging us as a humanity all the time to save a dollar. Yet we'll go and then take those dollars and go and put it into a war and weapons of mass destruction. Somehow I think we've got the thinking a little out of balance.
Yes, yes, definitely out of balance. And as you reflect on that um challenge or conundrum between those two, you 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 have to think about get, how that relates back to wellness from the individual patient's perspective, and and moving from sick care to
Mm,
well care.
yes.
That makes such a big difference. And I love the way you included the spirituality, and
Mm-hmm.
we've touched on so many aspects of nutrition and
Yes.
exercise and healthy air,
Mm-hmm.
healthy water. All these things are so interrelated and really can't be separated.
No,
It's
it's the whole of us, right?
yeah,
We are a part of this planet. Everything that we do, good or bad, to this planet is we are rooted. We are vibrationally, partically, all a part, energy, all part of this planet. If we are sick, we bring sickness to the planet. The
yes,
planet becomes sick in itself and it can't provide us, right? We have to make a conscious thing to invest in the well-beingness, spiritual, mental, physical well-beingness of all life forms, because then we bring that lifeal energy into the planet that sustains us so well. The planet's in trouble because we are out of sync. We're in trouble. And
yes,
in order to bring that order back in, we need to bring order about.
yes. Well, and it's fascinating when you think about that and the analogy, at the beginning to the beginning of our conversation, where we discuss the philosophy of just fixing something.
Yes.
And this is one of I think it's such an important point, is that when we look at reliability and we look at processes that empower people to have this aspirational change and to have good health, those processes have to be established in a way which is first and foremost focused on the goal at the end of the journey, or the destination, as the case might be. And that's very different than thinking about just trying to fix something, like
Yes.
looking at a particular aspect of a problem, whether it's the planet or the
Mm-hmm.
person.
Yeah.
We have to think about, well, how do we make this journey as smooth as
Mm-hmm.
possible? how do we respond to inevitable variability, and how and if we're going to respond, what we're talking about is people.
Yep.
People have to have the education, the training, the resources, alignment of resources, and information that enable them to be most effective at influencing that particular environment in which they work. And that's important. We talked briefly about this idea of learned helplessness, and I hear this so many times when I speak to healthcare groups, is this idea that, well, we just can't, the system is too big, we can't
Yeah.
control it, I'm too limited. But what we have to think in terms of is, what is our sphere of influence and how can we make that better? And also realize that if we're empowered, now this is the key, we have to, leaders and managers have to empower people to be able to function at the local level and to make decisions. We have to have guidance, right? We have to have norms, but people have to be able to
Be
look at
flexible.
the situation and use their judgment, right?
Yes.
And
Yes.
then and then all of a sudden learned helplessness changes to a philosophy of, I can
Mm-hmm.
do better for those around me
Yes.
and
Self-empowerment.
yeah,
Mm-hmm.
make a little difference. and
Yeah.
and if everyone is able to do that, well, then
The domino effect.
cumulatively
Yes.
you can make a big difference.
That's what it's about, the ripple effect,
Yes.
right? How many times do I hear, I'm only one person, what difference can I make? I say,
Yeah.
when you change, those around you change. Those around you who have changed become part of your change.
Yeah.
And it grows and it grows and it grows. And that could be negative or positive, depending what your change is, right?
Well, true.
Be careful what you seed, water it well, nurture it well, believe in it, give it the energy it needs, and allow it to grow. It will attract other like energies that are growing in that way. And collectively, all of a sudden, you have a field of possibilities. But that one person is you. How are you going to change things in your own life to empower yourself so you can be that empowerment for someone else? And when we find something we believe in, like you are doing right now with your book, you know the change is needed. You're in the midst of it. You see it around you all the time. You know what is needed as a physician and as a human being. That's the reason why you're doing these shows. This is the reason why you've written this book. You are inspiring people and inviting them to step up, not angst, not pitchforks,
No.
but to be a part of that system, to bring forth the ideas, to support the ideas, and to get others to support the ideas and create that ripple effect. But if we want to see change, we have to be the change.
So true. And it's a challenge, right?
Yeah.
It's a
Yes.
journey.
So
It's
calling.
it's a calling.
Yeah.
Yeah, and you hope, you hope that, I think that ripple effect is so true. I've often thought in terms of sort of train the trainer as well,
Mm,
where you're there's a certain degree of inspiration, but there's also, yeah, especially in healthcare where people, want evidence.
yeah.
Fortunately, there is good evidence, that some that I've published and many, many others who are smarter than me have
How
published
as smart as you.
have have published very good evidence that if we accept some of these philosophies and we look at process improvement and we look at how do we manage complexity and how do we appreciate the individuality of all the members of the community, all the patients we see, how does that actually make a difference? And it can. I think you're absolutely right, Sarah. Is this ripple effect is so powerful, and I think that part of my goal at this stage in my career, as I think about this, is how do you really get the resources aligned,
Yeah, like
whether
they're
that's
there,
yeah,
right?
yeah.
It's redirected.
How do you redirect it, and
Mm-mm.
how do you get it there? And you know, as one individual, you're never going to change the
Mm.
payment model or anything like that. But again, if you look at that frontline interface between patients and caregivers, whatever the caregivers are, a physician, a nurse, a dietitian, they're all important and they all should work together cumulatively for the health of the patient.
Yeah.
Well, how do you allow them to be more effective and more efficient and to function more as a team? And I think if we acknowledge the ability
Mm.
to trust people, that's a big part of it, right? You have to
Yeah.
trust people. I always thought, as I started to think about reliability and patient safety, I said, with a very rare exception, nobody comes into work in a hospital or a clinic thinking, "Oh, I want to cut off the wrong limb during surgery," or I
Which
I
one are we
want
going
to,
to slice and dice today?
yeah, right. I want to give the wrong dose of medication. That's the, we have to know that there is some small degree of evil in the world, but it's a very small, and it's a very rare. And we have to realize that essentially everybody comes into the healthcare environment, into work every day in whatever role, wanting to do the right thing for other people. That's why
Yeah.
they went into the profession. And as leaders and managers and people who want to inspire change or even think about transformation, our goal has to be to create processes and environments that allow people to do the right thing
Hmm.
and to provide, we want to optimize human
Yeah.
performance. And that's so important. It's almost revolutionary when you think
Mm.
about it. It changes the dialogue from what did you do wrong
Yes. To what can we do
to,
better?
well, or how can I help you to do
Yes.
better?
Yes.
Imagine,
Yes.
imagine if a leader or manager comes into a clinic where things are in disarray and the patients are waiting and
Mm.
they're looking for somebody to blame. That just increases the chaos.
Yes.
On the other hand, if you come in and you say, what can we do to make it so that you can be more efficient and effective at your work? What can I do to help you? That really is such a different approach. And getting back to that word compassion,
Hmm.
I love that word because
Yes.
it's different than many times people talk about empathy,
Yeah.
and that's noble as well. We should understand feelings, but the beauty of the concept of compassion is that it doesn't stop with understanding.
Yeah.
It
You just care
embraces,
anyway.
yeah, it embraces action,
Yes.
and meaningful action
Mhm.
that make it, in the case of healthcare, make it easier for people to do their job, to do the right, I like to say, do the right thing for the right patient at the
Mhm.
right time.
Yeah.
And that really sort of sums up the approach that I try to inspire when I talk to leaders and managers and people who have influence in healthcare.
And that's what the book is about, right? Showing
Yeah.
those solutions, a different way of looking at things. What if we did this? What is the end goal? A healthy patient, right? No
Yes.
longer a patient, a healthy being, right? Um, and how can we get there? And how can we support the people that are doing it? And
Yes.
how we can stop putting so much pressure on one caregiver and the other not, as you talked about before, team. How does each member of the team feel supported in what their part is, right? And make sure that the money that is coming in is actually going into productivity that actually will get that patient healthier faster because of the support.
100%. And that's where we have to align the money. We
Yeah.
have to align the resources with what really are the goals. And we have to think about even, at a management level, key performance indicators
Mm-hmm.
and what are we really judging people's performance on? When we think
Yeah.
about, when we think about it, I just somebody sent me a little online survey, and it was very brief, and it was asking questions like, what do you think physicians should be paid for? Number of procedures or quality, and how should we measure quality? And I
Mm-hmm.
think those are really, really important, and unfortunately, when we look at the incentives,
Mm-hmm.
sometimes they're just misaligned. Like
Yeah.
I've heard so many times, I've sat in administrative healthcare leadership meetings, and so many times I've heard that if we put surgeons on a straight salary, they'll be lazy and they won't do as many surgeries as if we pay for every surgery they do, which euphemistically is called the eat what you kill model, which, which, believe it or not, is used in the healthcare boardroom all the time.
My God, a
And there's
horrible
this,
saying.
yeah, it's awful, right? But there's this idea that, well, if you incentivize a surgeon to do surgery, and there's probably some truth to this, they'll do more surgery. And sometimes it's easier to just do a surgery than to sit and talk with a patient and tell them, well, there are actually some alternatives.
Mm-hmm.
Um, like, maybe we'll help you lose weight, or maybe we'll help you improve your nutrition and diet, or something like this. But these things are misaligned, and we really have to transform the way that the dollar flows through the
Yes.
system at some point. We
Yeah.
truly do. And that doesn't mean limiting care.
No.
It means
It's actually
improving.
extending the care,
Yeah,
putting the
extend.
money into the extension rather than just into one pocket.
Yes. Yeah, it's so true. So I don't know. I'm as I said, the optimist. I think it's an exciting journey, and
Please keep the optimism up, but because it starts by somebody's conviction. It starts by somebody saying, look, instead of just saying the system's broken, it's need to change. Well, you've come up with how it should change. You've come up with the procedure that one could take, where the money could go, how it could actually help the patient no longer be the patient, because that's the ultimate aim. They're
yes,
well, they're no longer a patient, right? And that's what you're ultimately aiming. And, back to my doctor saying, well, then where's my next patient? There's always somebody going to be sick. There's always going to be somebody that
yes,
needs a surgery. That's just the nature of law. But the ultimate aim for a physician should be, I don't want to see you per se. I
yeah,
want I want to know you're well enough, that you're out there living your life and being productive. And we were part of your wellness journey. And
yes.
that's really what you're promoting instead of it being so choppy, like, like a car manufacturer, where one person does this, one person does that. No, you want the team, a team a team you can rely on, a team that understands what you're saying, a team that can also take incentive because you're all in the same groove, that to know how to treat that patient. And that means you're going to get those patients healthier so much faster and staying healthy and not kind of coming back with the same old thing again.
Right. No, that's, yeah, it really is a bit of a philosophical change from what
Mm.
we've experienced over the last 2 decades, but it's an exciting change. I think the one challenge that we still have, which is so important, is to ensure that patients understand and know and have the ability to be part of the
Yeah.
solution, as you described. That
But
really,
also the insurance companies.
and the insurance, yeah,
You know, because
yeah.
very often they may want to be proactive, like, having physiotherapy after they've, had an operation, but no, that it's not covered. So that,
Yes, that's so
right, then they
true.
don't get that, so they don't heal properly, and then it creates other problems down the road. So, yeah, I think insurance companies need to come to the table, not looking at everybody as a dollar sign, but looking at, okay, with your system, this person actually becomes healthier quicker and therefore less on our dime.
Right. And it has to be a long-term view too,
Yes.
right? It has to be so it's interesting. You can think about let's say your insurance company was focused on house fires.
Hmm.
And you can think about, well, one approach would be to go to the community and say, I want you to have a fire station every 3 blocks.
Hmm.
Because that way, if a house catches on fire, we can get there and only 20% or half the house will burn down. And we can congratulate ourselves and say, wasn't that great? The whole house didn't burn down because we have all these fire stations. What if, on the other hand, and this is starting to happen, especially where I live in the mountains, the insurance company said, well, we're going to have those fire stations, but we want you to focus on prevention. We want you to remove
Mm,
the dead trees from around your property,
right.
not have any bushes. We want you to have a building code where the roof doesn't catch on fire with every little ember that might
Right.
hit it. And you might have a sprinkler system
Mm,
in your house to prevent things even before the fire department came. Well, that makes so much sense.
yes.
And you know, in the healthcare insurance world, thinking in those sorts of terms,
Prevention.
you have to have the hospital, which is like the fire station, right? You have
Yes.
to have that. But what you really want to do is invest and create incentives for people to have those preventative things. And then you know what happens at the end of the day? Not in a year, but in maybe 3 or 5 years, you realize, wow, the forest fires aren't as bad as they used to be.
Yes,
And we can
exactly.
reduce your house insurance, which
Right.
actually just happened to us this year for next year, which is great because up here in the mountains of California, with some of the fires, just like you've had
Yes, yes.
in areas in Canada,
Yeah.
the insurance prices have gone,
Skyrocketed.
you skyrocketed
Yeah.
to the point for some people of being unaffordable. And I think the analogy to, um, healthcare is really true. We
Yeah.
have to we focused a lot on responding to the problem, responding
Yeah.
to sickness. And what we need to do, we still need to do that where it's necessary, but we need to invest and focus on those areas of population health and
Yes.
prevention and wellness, which diminish the need to rely on those sort of what should be a safety net, right? Like the
Yeah.
hospital should be a safety net for the sickest of the people who
Yes.
can't be managed any way else.
Right. Well, I know, of course, in America, you don't have national health. And,
No.
here in Canada, we do. Fortunately, the basic health treatment is there. But of course, the problem we have, like here in BC, we have a million people without doctor. Which they're slowly kind of bringing doctors over from other countries. They're trying to reduce the weight, the premises in which they practice from, support there. It's slow, very, very slow. And it's going to be a long time, before we actually get doctors. And what we're seeing more now is more of the nurse practitioners stepping up into the
Yes.
role. And even they're hard to get. But they're being that buffer, so they can refer to specialists or this or that, but they actually give more time. And so they're actually favored quite a bit by people. Um, when we know what the problem is, it's not for one person to say, da-da. It is for all heads to come together and go, okay, how did we get into this? Because we want to make sure we don't repeat it. What can we do that actually looks at the health well-beingness of everyone in the population? And that means your poverty people, they have
Yeah.
medical treatment as well, they have dental. Um, and if we're not looking at people as human beings and only like, I've interviewed people where, I had to go to emergency. I didn't have medical insurance. It cost me $10,000. I had to sell my house. And that is sinful as far as I'm concerned,
Yes.
sinful. And I know that politically, healthcare is purely a ping pong game between each party, and that the one doesn't want the other one to have it, and it's just crap. Sorry, it is, because neither one, none of them are putting health of human beings first. And if you, the street level up, poverty level up, they all had medical care where we could really address it before the situation gets too bad, you wouldn't have all this drain going on in the medical system. Stitch in time, folks. Let's start looking at people as human beings and invest in them. We've got so much into commodity and not human beings, and our human beings, the depression is on the rise because people do not feel connected to themselves, to society. They feel lost, they feel thrown away. We throw
Yeah.
things away. We're so incredibly wasteful in the Western society, and we're now throwing people away, and this has to stop.
Yes. Yeah, you're very that you hit on so many topics there that are so true and so accurate. And as I think about your comment about throwing people away, that could be a whole nother hour-long
You have to
conversation.
come back then.
But I will tell you, it's interesting, eh, really thinking about the complexity of our healthcare system. So there are many very, very talented, well-meaning people on the provider side, the caregiver side of healthcare, who feel abandoned
Yes.
and who feel disposable and who feel like they have a tremendous amount of um, passion and commitment and training, obviously, years and years and years of training and experience. And they feel, I've heard this
Chewed
so
up
many
and spat
times.
out.
Yeah, like they feel, well, I'm just replaceable.
Yes.
Like it doesn't matter anymore. I'm just punching the clock.
Yeah.
Um, and that's really a sad statement about that. And of course, if you're feeling that way on the provider
Yeah.
side, inevitably that transfers to one degree or another to the patient on the receiving end of the
Yes.
care,
But the
right?
patient feels they don't care. You
Yeah.
just want me out of here, doesn't matter what my needs are. You just want me out of here. And you
Yeah.
and then the patient feels, next. And
Right.
that's what medical system kind of feels right now is next. And it's
Yeah.
like, but like I said before this call, I was talking to my phone doctor. I'm allowed one question, 3 minutes. That's it. One question, 3 minutes. If I need to talk about anything else, I have to call in. However many times I need to call in to address anything else. And it could be a different doctor. So it's never going to be the whole, right?
Right. And
So,
yeah,
how the frustration of the patient is there. But
very
if the
much.
system, and of course in England, what the problem is a lot of them are doing this phone thing now. They don't want to go back to surgery. They don't want to go
Uh,
back to seeing patients. They get more money by doing the phone or the Zoom calls rather than actually seeing a patient.
oh,
So,
that's disturbing,
yes,
right?
yes,
And very frustrating. And then that disconnect. I guess there's pros and cons, right? Like the timeliness for certain things
yes,
by having a televisit is wonderful.
right.
Um, and if you can, one example is my wife's getting some healthcare now, and we live a 3.5 hour drive from the fantastic group of physicians where she's getting her care. But they've arranged to do some of it by the televisits, although I will say they allow more time
Yes.
than three
Yes.
minutes,
Yeah.
and they've been really good. But you still have to have that uh,
Eyeball touch.
eyeball
You know,
touch.
how you remember doctor used to feel the glands. Are they up? Are they this? Look at the mouth. That's not happening. There is the lack of touch there, and that's
Yeah.
where the patient feels disconnected. So yes, it does serve as follow-up. It does serve as maybe even initial assessment. You know what? I actually need to see you. I can't
Yes.
address this way. So yes, it has its place, just like AI being able to take all the information, diagnose, and give you some ideas of what it possibly could be. So your brain cells aren't constantly chasing around, right?
Right.
All of these things have a thing as extra, but not in place of.
That's a great way to phrase it. They're resources. They're not usurping
Yeah.
that knowledge and human interaction.
Right.
They're reinforcing and supporting. And that's I think so exciting.
Yes.
And I think, at the end of the day, honestly, I think that these changes that we're seeing, the realization that we've pushed the system to its limits, it has to change, it has to accommodate to some new realities. Well, at the end of the day, if we do that correctly, it it will really strengthen that humanistic relationship. And that's why, I emphasize that idea of compassion and be compassionate,
Yeah.
because as we think through
Hmm.
the technology, the structure of our system, the appropriate use of resources and money, we have to think of it in the context of what are we really doing for our fellow human beings. And
Yeah.
then if we take a step back and we realize, gosh, if I'm making these decisions, I better realize that at some point I am going to be a patient.
Yes.
Every single one of us will be.
Yes.
And then hopefully that reality will provide some wisdom and some guidance to those who are making the decisions for the rest of the population that they're serving.
Right. There is always a solution. I'm an optimist too. I always believe there's a solution, but compassionate, calm heads need to prevail. If you're not coming from the passion, the conviction of what needs to change, then you haven't got the right energy behind it. But the calmness to see the clarity of the solution has to be there. And we can make these changes. When we look at someone's life that they're 30, 40, 50, 60, whatever the age is, and their life has been completely turmoiled. Well, do they give up? Oh, no, my life has
No.
been a whole load of codswallop and I may as well give up now. No, it's never too late. Never, ever too late. And just because the system, rather like politics, has become a sewage pit, doesn't mean that we can't get in there and clean it out and reconstruct it. It just needs calm minds, passionate hearts need to step up.
Yes.
Saying that, how do people get your book? How do they find you? How do they have this extended conversation with you?
Oh, well, it's been wonderful, the conversation, and I hope to continue it. And the easiest way is just douglasslakey.com. That's my author website that they
Can you
can
spell
get
that,
to.
please, for people who are listening?
Yeah, DouglasSlakey.com. That'll get you to my author website and give you some more information. My book will be coming out in the next week, and we're having a book launch party on December 11th. And I hope we have lots of great interaction with people who are passionate about this subject and the topic.
And you've put out there how you see it from the surgeon's point of view, from being in the medical industry, what you feel would work. What you're doing is inviting the conversation, right? Inviting other people, the nurses, as is even the janitors, everybody. What if you did this? What if we did that? And then when you've got something that, really like this is going to work, or we've practiced this and it does work, how do we then as a collective then go to the accountants and the money people and go, this will save you money, because that's all they're interested in,
Right.
right? Your investment here saves you money over there, right? And then if you could talk money talk to them, don't talk human, they don't care. Talk money talk to them and show them how this investment over this period will save them money down that period. And then maybe they'll start to listen. But it's a choir that needs to go, right?
It
A
is. And
chorus. Yeah.
yes, yes, it has to be the whole team,
Yes.
everybody engaged.
Yeah.
Absolutely.
I'm going to have you back again. We've got so much
Oh,
more to talk about. Absolutely. So, folks, it's Douglas Slakey,
yeah.
SLAKEY.com. You can find the book there. Let's get behind it. You know what? Christmas is coming up. How about you give the book to your own practitioner? To your own doctor. Let them read about it. Let them get behind it. I'm sure they're going to agree with a great deal of it and put the wind behind their wings. What a great Christmas gift to give all your medical people, right? They want to know that somebody else has stepped up with an idea that they can follow, that they can endorse, that they can be a part of. Not everybody wants to take it on. You've taken it on. And now here it is now for others to pick up and help carry forward.
Well, thank you. I hope we're going to inspire some people. I think our conversation was really one that focused on the human aspect, which I love, and I think is really the foundation of how we're going to move things in a positive way as a group and a society.
And I'd like you to come back where we can actually talk about it from the physician's point of view. We talk about veterans, and we talk about police when they have to take a life or lose a life, or faces with a situation, and how it can be post-traumatic stress, how it can be very anxious. And of course, you're a doctor, you're not allowed to get anxious or
No, no.
depressed, right? But how we can be more understanding of the medical world and the medical people and what they're dealing with,
Yeah.
right? So I'd love you to come back and share that with
Well,
me.
thank you. This has been an absolute delight. And, congratulations on what you've put together. It's really fantastic.
It's all because I get good people like you.
Oh, wow, that's awfully kind of you.
I love
Well,
what you're doing, so thank you for doing it.
well, thank you. And I look forward to staying in touch.
Yes, definitely. Have you back next year for sure. So
All right.
everyone remember, if we want to see the change in the medical system, because it's not working right now, neither for the medical industry or for the patients, and we do need to be that change behind the back. Yes, we can moan about it, but what are we going to do about it? Let's get behind this book. Let's get behind this movement and start seeing the system change, because when it changes, it serves everybody. Until next time, folks, bye for now. We hope that you enjoyed the show. There are so many more for you here on selfdiscoverywisdom.com. Just go to the podcast tab at the top there and you will see all the many genres and all 3,000 shows ready for your listening. We are here to serve you, to help you on your journey of life, and we know that through inspiration it begets invitation. We are supported by you, the listeners, and those that we interview. Anything that you can spare us in donation would be greatly accepted, and we do hope that you enjoy the next show.